Hey, what's going on, everybody? It's Dr. Matt from Pinnacle Chiropractic, your local pediatric, prenatal, and family chiropractic office here in the Lakewood Ranch, Sarasota, Bradenton, Florida area. In today's video, we're going to talk all about pediatric chiropractic care and the perfect storm. So, what the heck does a pediatric chiropractor do, and what the heck is the perfect storm? I'm going to answer both of these questions in this video today. And for parents whose children are struggling with autism, ADHD, sensory processing disorder, anxiety, or even things like epilepsy or autoimmune challenges, you're going to want to hear the answer and explanation to these questions as well, because it's going to help you finally get to the root cause of your child's chronic health challenges. So this video is for you parents out there. If you've been up late, we call them the warrior moms that have been up late at night searching for answers and researching your child's health struggles. And maybe you've already tried different things like the detox is the diet changes, vitamins and supplements, all kinds of different therapies, and maybe even medications to help, but your child is still having struggles. So this video is for you parents out there that have been down that road. So the perfect storm really explains how early stressors or stress and toxins show up in our kids' lives and begin to really wreak havoc on the function and the development of the brain and the nervous system. With our office as pediatric chiropractors, we talk all about the brain and the nervous system. So the brain and the nervous system is really that main operating system that controls and coordinates every other system and cell and tissue of our body. So we're going to start with really kind of a story, and that really story is the story of Avery. That is Jen, our office manager's daughter, and she's really the why of behind why I got into pediatric chiropractic and went full throttle in this lane to really building our practice of 4 doctors now trained in pediatrics, and taking care of a lot of kids with different perfect storm challenges or the ADHD, sensory processing disorder, autism, things like that. So basically, Avery came into our office about 6 years ago, and she came in with a lot of sensory processing disorder challenges. She was unable to go into public restrooms because of the noise. She was unable to be in crowded places and lots of stimulation. She was unable to regulate her emotions, especially after school. She did a good job of holding it together while she was in school, but after school is when she let it all out. And so they started care with us, and within a few months, she was a totally different child. I actually received a letter or email from Jen, and she was telling me that this was the first time they were able to go on a family vacation for the first time ever in Avery's life. And they went to Orlando and Disney World area, and she was able to be in a new environment, something that is normally stressful for her, and she was able to handle it very, very well without any big explosion of emotions or big sensory meltdowns or overwhelm or those feelings of anxiety and fear. And so at that point, that was what really locked me into really pediatric chiropractic care, was because of the impact that I was not only able to make in that child's life, but also the entire family's life as well. So a few months later, I asked Jen to join our team at Pinnacle, and she's been with us now for 5 going on 6 years in the office, and we've been able to take care of hundreds of similar cases to Avery's now, where we have a ton of experience working with these perfect storm cases. So we'll really get into the science and the steps that we're going to talk about next of that perfect storm. So number one with the perfect storm is really pregnancy stress or stress during the pregnancy. So our clinical experience and really the latest research, both of those things are starting to show a link between stress during pregnancy and chronic health challenges later in life. So unfortunately, in today's medical system, we often diagnose moms as being pregnant instead of celebrating and empowering them. And we live in such a highly stressful and chaotic world that we then find a lot of stress on a baby's nervous system already begins to form within the womb in utero, and sort of sets the stage for their nervous system to be more easily stressed and overwhelmed later in their life. And so from there, the second thing we find again and again, and this is a very common thing we see in a lot of these perfect storm cases, is there's a high correlation with birth intervention and birth trauma showing up in about 85 to 90% of these perfect storm neurological cases that we see in our office. This is also now being shown again and again in clinical research as well, which is catching up and starting to connect the dots between birth intervention and trauma and chronic health challenges later in life. So things like forceps and vacuum extractions, emergency C-sections, inductions, or manual assisted birth interventions place a ton of physical stress and trauma on the delicate neurological centers of the brainstem and this upper neck area. And that area really controls and regulates what's called the autonomic nervous system. So that autonomic nervous system is in charge of the core developmental and health functions, like are things that we need basically to function. So sleep, eating, digestion, immune function, motor planning, and more. And additionally, this area also in the upper neck region houses the vagus nerve, which is often injured or it's interfered with via that birth trauma. And now the nervous system is not able to slow down, it's not able to relax, it's not able to digest and properly process and regulate the stressful and toxic environment that our kids are growing up in. And finally, the third piece of the perfect storm is common health challenges or early warning signs that we see in babies like colic and reflux, constipation, or chronic ear infections. These symptoms are often early warning signs showing up when they're infants or even into early childhood, which then lead to the whole medical intervention, which is antibiotics and medications that wreak havoc on our gut, our immune system, and overall neurological development. So a recent study from JAMA Pediatrics found that antibiotic use in the first year of life increased the child's risk of asthma and allergies in early childhood, and other studies have linked their use to chronic health challenges like obesity and ADHD. So that perfect storm is basically those events: stress during pregnancy, stress or physical stress or birth trauma via birth intervention, and early warning signs, early indicators showing up. And then once those kids reach age 3, 4, 5 years old, that's when a lot of these bigger chronic health challenges they're starting to get diagnosed with: the autism, the ADHD, the sensory processing disorder, epilepsy, those things that are wreaking havoc on a lot of kids in our society. So if you think this perfect storm is what your child has gone through and is possibly even going through right now, then you deserve to find out if this truly is what's been going on the whole time, if it's really getting down to that root cause of their brain and the nervous system dysfunction, and finding out how we can help. So reach out to our office, or to, if you're watching this and you don't live in the Sarasota, Bradenton area, reaching out to a local PX doc's office, which is our trained doctors that are trained in this pediatric chiropractic care. Schedule a consultation and the insight scans, which really measure the nervous system, appointment to learn more and find out how we can help. So if you found this very useful, we ask that you share it with other people that could benefit from this. Like, comment, visit our social media pages at Pinnacle Sarasota or at Pinnacle Chiropractic Sarasota on Instagram. So visit those social media channels. We're constantly pumping out new information and educational information on these videos. And our biggest goal for this is just to bring more awareness about pediatric chiropractic care and bring more awareness around the root causes of a lot of these chronic childhood conditions that we are seeing becoming more and more prevalent in our society today. So hope you guys really enjoyed this video. My name's Dr. Matt, and as always, guys, be well. We will see you guys on the next video.